So consequently, we're not reading a lot of research, tapping into those particular resources. And you don't always know what the latest information is. That's my job, to explain to the parents that I come in contact with and to the child care providers that I come in contact with, what the latest information about keeping babies safe is. Another story in the African American community is, can I refer to when I was a child, and I knew a couple of mothers who had lost their babies in our neighborhood, and I had asked my mom, what happened to those babies? And she said they died from crib death. And I said, what is crib death? And she said, she was a smart woman, but during that time she could only respond to me with what she knew. And she said, well, it's when the baby dies in the crib. So at 14 years old, I thought the crib must be causing the death. So that was 100 years ago, right? So last year, I did a workshop at one of the group homes in the District of Columbia where they had lost a baby. And the baby was co-sleeping with the mom, and they all had cribs. Each mother who had an infant had cribs, but they were not using the cribs because they thought that the crib causes the death of the baby. It would cause crib death. So I was overwhelmed that all of those years ago, when I had that same thought as a teenager, that in 2003, some people may be thinking and feeling the same way.
Another issue is really the trust in the health, the medical, mental health system. We put a lot of trust in health information. Although I think we're hearing even from the general public now, every day I read something different in the paper. Today I'm supposed to, if I eat bacon, it's terrible. The next day it's fine. Drinking wine is bad for you. Drinking wine will keep you alive longer. I think a lot of people are feeling a little bit uneasy about the kind of information they're getting about their health. But imagine, particularly for populations who've had a really negative history with the healthcare system. One example for the African American population, the whole Tuskegee experience, makes people leery of information that may be coming from health sources. The same is really true because a lot of health promotion comes from public health agencies, which are government agencies. Do people have trust in information from governmental or official sources? Imagine if you have moved here as a refugee from a country where the government was really trying to do you great harm. To be able to make that switch to the government is some beneficent organization that's trying to promote your health, it might be a big jump. So we have to understand that piece and how it relates to how people will perceive the benefit of what we're offering them. Now there's perceived barriers. How difficult is it going to be to do this? A big one, of course, that we have to think about in our communities is economics. If we're asking people to do something that requires resources, costs money, takes time from work, all those kinds of things, then that's going to be a barrier that we have to understand. And our health promotion effort, beyond just telling people what to do, we're going to have to think about the how and how do we support them. Another issue is going against traditions or the advice of elders. The message we're giving may be very different than what they're hearing from elders in their community. That's going to be a barrier to them making those changes that we're talking about.
But basically, I will do what doctor suggests. But if something my mom or mother-in-law already done in my baby, it's okay, it's fine with my baby. I will stick with them because I want to show respect to them. They are experienced and they come here to help me.
And then just language barriers in general. I mean, if we're working in English, somebody doesn't speak English well, understanding the behavior change message can be problematic. So the language barrier is another one.
The presentation we are providing for this is in Spanish. The handout and everything is in Spanish for the Latino communities. So they are more comfortable when someone comes and talk to them in their own language, and they can relate it to it because we come from almost the same backgrounds even though we do things different in our countries, but we can communicate. They feel more comfortable when someone from their own language, because they can ask questions, they want to know what's going to happen.
Now we get to cues to action. As I said, this is sort of where we are. This is what we want to be doing. We want it, whether it's media campaigns or training, brochures, word of mouth, other kinds of things. From the cultural competence and linguistic competence perspective, we need to think about a few things. One is really the credibility of the sources. We think that, we have science, so we're credible. But for families and individuals in diverse communities, it may be religious leaders who are credible. It may be civic leaders who are credible. It may be elders. It may be healers, other folks. And if we don't understand that, who's credible, then our message will get lost.
Like from doctor, from friends. But I think, like for the Chinese students, graduate students here, there is a very useful information place that's on the internet, because we have a discussion group consists of many Chinese parents and Chinese graduate students here. So everybody will share the experience to take off babies with each other, and many things are really helpful. Yeah.
We also have to talk about preferred ways of getting information. And we often think of the brochure. Here's the brochure. That doesn't work for everybody. For some people, printed material works. Sometimes printed material with pictures works. Sometimes it needs to be an oral thing. Sometimes it needs to be an interaction, because from their culture, important issues are dealt with in an interactive process.
Many times they will come to a clinic or a healthcare provider, and if one person comes and trusts you, like everyone else, they will bring their friends. Word of mouth travels a great deal. So whatever you do is going to bring about word of mouth. And if you want to start working with people in a community, you start that way. You start small. You start with one or two trust people to take you into the community. You develop that relationship. It's not a one-time, I'm going to hand you a pamphlet and pat you on the back and send you on the way method. You can't do it that way. That's what they've always done, and it doesn't work.